A new restorative medical treatment is changing the game for chronic low back pain sufferers in the Salt Lake City area. Reactivate is an innovative technology allowing patients with severe chronic low back pain to find relief by treating the cause of what's hurting them, not just the symptoms.
As a pain physician, I see chronic low back pain sufferers all the time, every day in clinic. There was very little that could be done for patients suffering from multifidus dysfunction. Reactivate therapy is finally changing that.
The Reactivate device was a game changer for me. My life was in a very dark and painful, miserable place, and post-surgery it's just been up and up and up and up, and now I'm pretty much back to normal. The Reactivate device gave me my life back, no question.
Meet Dave, one of the first Reactivate patients in Utah.
I'm 56 years old, always been super fit and healthy, never broken a bone in my life, never had a surgery. My pain came on about 3.5 years ago. Fairly quickly, it was a fairly sudden onset, but wasn't caused by a car accident or lifting a heavy weight or anything. So I went through a myriad of different treatments, saw 3 different surgeons, told I wasn't a candidate for a fusion or a disc replacement, and was then introduced to Dr. Joyle after many different experiences with various pain medications and treatments. And everything that I was getting to that point was just really controlling the symptoms. It wasn't treating the cause of the problem. And that's what Reactivate did. It went straight to the cause of the problem and fixed that rather than just treating the symptoms. So I was over the moon to be given a diagnosis and say, we know what the problem is and we have a fix for it, and it's a relatively straightforward surgery.
It turns out Dave was suffering from an especially severe case of mechanical low back pain caused by dysfunction in the muscles supporting his spine.
When we lose the function of the multifidus muscle, the other muscles in the back overcompensate because they can't support certain movements that should be automatic. They overload, and that's where the pain comes from. I offer Reactivate therapy because of the great results I see in my own patients, as well as in the clinical studies. 90% of patients report being very satisfied with the treatment, and those results are continued out to 5 years. Those types of results are really quite unheard of in the pain space.
For the amount of pain that I was in, the chronic pain, debilitating pain, that I just wasn't able to function, even on a basic level, it's incredible to think that that was caused by multifidus dysfunction, just by a muscle or a group of muscles that just decided that they weren't going to work anymore, and that it wasn't anything sinister and serious, anything skeletal. It was a muscular problem. But I'm delighted with the results because I look at where I am now. I've been to the gym today, and where I was 2 years ago, I couldn't put my shoes and socks on. It's an absolute night and day difference.
You should be able to bend, twist, lean over, sit and stand for long periods of time without fear of back pain. If you're having intense pain doing these normal activities, or like brushing your teeth, doing the dishes, or yard work, you should be evaluated for multifidus muscle dysfunction. You don't have to live like that. Recovery is possible.
Reactivate will be holding a free low back pain patient education event on January 15th in Draper, Utah. To learn more about Reactivate and get the details, visit www.lowbackpainrecovery.com/Utah Reactivate event.